Hello everyone, I am Nancy Harvey with Opargo. Thank you for joining the Opargo webinar. Today we're going to focus on optimization for patients and your practice. We're going to host a Q&A at the end of the webinar, so feel free to use the webinar tools to ask any questions that you might have throughout the presentation, and then we'll address those at the end. We're going to start today with getting a glimpse into the trials and tribulations of Karen's first day of employment at the medical practice of Knit, Picky, and More. Let's see what Karen's up to.
We're glad to have you here, Karen. It's been a challenge keeping up with our recent growth. I hope you don't feel too overwhelmed on your first day at Knit, Picky, and More.
I'm excited to be here.
We've got 20 doctors at 3 locations. Unfortunately, the last 3 schedulers couldn't keep up with the workload. Let me show you to your desk.
Well, I'm experienced, motivated, good with people, and I love taking care of patients. I'm sure I'll be able to handle... Holy Florence Nightingale!
Hi, I'm Dr. Knit, plastic surgery. You name it, I can tuck it, tilt it, or even trim it. All you really need to know is to keep prime slots open for me. All right? Good luck. You'll need it.
Got it. Plastic surgery, prime slots. I should be able to handle that.
I'm Dr. Picky, orthopedics. I work Monday and Friday mornings, Tuesday and Wednesdays late. I'm at the main office early in the week and the other branches later. I'll let you figure all that out, even though no one else could. Glad to have you on board.
Orthopedics Monday and Friday mornings, Tuesdays and Wednesdays late, main office early, other branches later. That's a lot to handle.
Hello, I'm Dr. Moore, general practitioner. I do a large volume of everything, every day, at every location. My philosophy is more means more. That's why I'm Dr. Moore. It was nice to meet you.
Any procedure? All the time? Every location? 20 docs, 3 nurse practitioners, and all these provider preferences. This is way too much to handle. Surely there's some software or something that can help.
Wow, Karen really has her hands full. We obviously took a couple of liberties being a little silly about very real problems that face practices every day. Opargo was created to overcome these and many other issues. The co-founders of Opargo met while in grad school. One of our founders is a physician, and the other an executive from the travel industry. They quickly realized that they could apply the same technology that the travel industry has used for years to healthcare. Both airlines and healthcare practices have limited resources. An airplane can only seat so many people. Medical providers only have so much room on their schedule for patients. The airlines charge very different amounts for different seats. We all know that a first-class ticket costs more than sitting in business class or sitting in an exit row or in coach. In healthcare, different patient visits hold different values based upon a few things. How medically urgent that visit might be, maybe who referred that patient to your office, or maybe some payer mixes that you'd like to emphasize. The airline industry then makes decisions about how to get the most bang for its buck with the seats that they have available. For example, the airlines know that on a Friday afternoon, a business traveler is going to present and need to travel on Monday. So what do? They hold seats on that Monday morning plane, knowing through their predictive analytics that that traveler is going to present themselves. They also charge more for that seat than they might have a family of 4 that bought that ticket way in advance. In healthcare, we know that if a patient has to wait 1 week for a new patient appointment, you're at risk of them finding care elsewhere. If they have to wait more than 2 weeks for a new patient appointment, you're at high risk of them going someplace else. So taking those same principles for the airline, our goal is to hold visits for the patients just like the airlines do. Opargo uses its predictive analytics engine to do just that. We literally hold seats on your schedule for the valuable visits that we know will come. Like I mentioned before, valuable isn't based just on reimbursement. It might be the medical necessity of the visit, the type of visit, or how that patient was referred. Opargo is a practice optimization tool. The optimization happens at the time of appointment scheduling by integrating with Allscripts in real time via a SaaS solution. Opargo lays right on top of Allscripts, checks of appointment availability in Allscripts, and then when you schedule an appointment in Opargo, it pushes that information back into Allscripts and looks just like you scheduled the appointment in Allscripts like you always have. We know how important it is to not break any of that downstream activity that starts with the scheduled appointment. So any of your patient engagement, EMR encounters, none of those things will be affected by optimizing your practice by scheduling appointments in Opargo. Here's a little more about how the Opargo data engine works. Opargo uses past schedules, rules, and preferences to rank appointments high to low. It then predicts, based upon your history, what appointments are going to present themselves, and holds appropriate visits for the patients that we know are going to come. And so what we do is we grab a year's worth of data. We take a look at when appointments were scheduled. How long did different appointment types have to wait to get an appointment? What did it turn into from an appointment type standpoint? What was the duration? What did we bill for it from a CPT perspective? And then what did that turn into from reimbursements from insurance carriers? Who reimburses poorly for this particular set of CPTs and who reimburses well? Then we couple that with provider preferences. When are your providers going to be in the clinic? What types of patients are they willing to see based upon the discipline that provider might be, or preferences as it relates to different body parts that they might be interested in treating? We also use the schedule templates in Allscripts to be a guide as to how we schedule. And then we also take a look at the referring providers that are responsible for patients coming to your clinic. How often are they referring? What is the quality of the visits that they're referring? And then we couple that, lastly and most importantly, with patient need. How urgent is that patient's visit? Or maybe if it's a chronic issue, does that patient really need an appointment right away? And we feed all of those things into the Opargo optimization engine, which produces an appointment, which is the gift on the right-hand side of this slide with a pretty bow on the top, which is an appointment for the right provider, right location, and right time. Let's take a look at how easy it is to schedule appointments in Opargo. Opargo has 3 screens. The first screen is the patient information screen. You can either choose to register your patients in Allscripts and then come to Opargo to appoint that patient, or you can enter all your new patient information into Opargo and it will real-time push into Allscripts. After registering the patient, we'll enter a little bit more about their visit. Who are they referred by? How urgent is that visit? What kind of a condition are they being treated for? Then, when you select Find First Available, you get the middle screen, which is the Best Fit screen. The Best Fit page is appropriately named because it's giving you the best fit of appointments for your practice's goals, as well as the best fit for this patient's need. If the patient has a super important need, high medical necessity, and needs to be seen quickly, we'll appoint them right away. If it's an issue that can wait a little bit, because maybe it's a chronic issue that's been happening for some time, we might give them the next available for a visit that wasn't held for those high medical necessity visits. We fundamentally believe that it's wrong to deny care. Opargo will never deny care. We're just going to prioritize the patient's visits based upon who needs care the fastest. So to select an appointment, we would just click the Add to Calendar button next to the appointment and location that best works for this patient. Then it pushes that appointment real time into Allscripts like we talked about before, and Allscripts returns an appointment scheduled confirmation screen. This confirmation screen can be printed and handed to the patient if they're in the office and they need a reminder, or you can use the confirmation screen to review, okay, patient, we have you scheduled at such and such location at such and such time. Looking forward to seeing you for your appointment. Super easy. Today we're going to discuss a couple of problems that we hear represent significant challenges in our industry. The first one talks about what are your no-shows and cancellations not telling you. In this example, the Opargo team used some data to identify trends. On the right-hand side, you can see an analysis of no-show and cancellations for this practice's new patients. We looked at the cancellation and no-show rates in comparison to how far in advance the appointments were scheduled for these 3 new patient appointment types. What we found was there is a direct correlation between the number of cancellations and no-shows and how long a patient has to wait for an appointment. So in this scenario, there's likely to be improvement in ensuring that your patients are seen within your optimal care windows. We've also found that this type of trend is an opportunity to look at schedule templates to make sure they represent true demand. Sometimes we find that the templates that we create for our providers are ever-changing, we know that, but we also know that they sometimes allocate with, let's say, 4 new patients on a day. That's all the template allows for. Well, what we do is we perform a study to take a look to say, okay, historically on Mondays, how many new patients are we seeing? And then we compare that to the number of appointments that are on the template. If we see there's a variant between those 2 numbers, we'll make recommendations to potentially add more new patient visits to that day. So how can Opargo help? Opargo ensures that patients with the greatest medical need are seen within the practice's acceptable care window. Remember, we hold spots for them on the schedule. This, of course, provides optimal care and reduces no-shows and cancellations. It also allows your schedulers to do their job, which is to take great care of those patients, be consultative, and provide excellent customer service. The second operational challenge that we're going to talk about today is the equal distribution of patients that are referred to your practice, but not directly to a provider. We find that patients are referred to practices one of 2 ways. First, directly to a named provider. Second, they might be referred to the clinic, but not a specific named provider. This represents a significant operational challenge in a lot of practices. Providers become hyper aware of the new patients on their schedule versus their peers' schedule. They're literally counting the new patients on their schedule and then counting the new patient on somebody else's schedule and then holding one of you accountable for it. So what Opargo does is we first take the practice goal into consideration using all the optimization rules that we've already talked about to this point. Then, based upon how we want to distribute those patients, we configure your database. This distribution can be equal across the board, or we can more heavily weight the distribution to certain providers. So if we look at the example on the right-hand side, the equality example where each one of the providers has 2 distributed new patients is equal. Everyone's getting the same amount. The provider preferencing model says one of the physicians is going to receive 5 distributions of new patients to everybody else's 1. Another thing we take into consideration are the types of patients that each provider can see. So maybe you have a multidiscipline practice and you have pediatricians and you have primary care providers. In this scenario, the pediatricians only want to see kiddos and the primary care providers only want to see adult patients. So we would equally distribute those amongst the providers that see pediatrics and those who don't. In the past, we haven't had good tools to keep track of distribution of new patients, especially in practices that utilize a call center where many people are scheduling for many providers. We found that practices struggle with staff playing favorites to certain providers. And sometimes the schedulers just don't know which providers are willing to see certain types of patients. When the rules of who will and won't see patients becomes too complex, we tend to see this problem present itself. Opargo then provides reporting and monitoring back to the practice. Obviously, it's difficult to influence what you cannot measure, so we provide good statistics back about how those patients are being distributed and then identify any areas for improvement. Opargo ensures patients not requesting a specific provider are equitably routed to the optimal providers based upon the patient's medical necessity. Again, allowing schedulers to do their job, take great care of your patients, and provide excellent customer service. Let Opargo do the heavy lifting. In addition to the 2 issues that we've just discussed, Opargo can accomplish many of your practice's goals. If we can make it easier to schedule, we can really improve a lot of things. Onboarding staff becomes easier. New employee training becomes more simplistic. We can also provide additional reporting back to your clinic on certain findings around how patients are referred to your practice, how patients are being distributed. What do your cancellations say about your practice, as well as what patients might be finding care elsewhere? This allows your practice to accomplish their ultimate goal: increase patients' access to care and improve the operational health of the practice or health system. Because if we're able to give a greater focus on that relationship with the patient and communication, all of these things fall into place. So now we're going to open it up for a question and answer session. Let me check the Q&A tool. I noticed that there were some questions that came in during the webinar. Okay, let's see. The first question: how does Opargo know how to schedule appointments in Allscripts? So I alluded to this a little bit throughout our presentation, but let me give you a little bit more insight. So Opargo uses its own optimization and configuration tools, coupled with the Allscripts appointment templates, to deliver real-time appointment availability. So it's going out there, it's checking availability in Allscripts, running the optimization algorithms, and then returning, remember, that best fit page. So then Opargo directly books that appointment. And once again, it's just like your staff scheduled it in Allscripts. It looks just the same. All that downstream activity stays in place. Good question. That's definitely one that we hear often, because we certainly don't want to make scheduling more difficult. Our goal is to optimize your practice at the time of scheduling. So certainly we have to make the scheduling be easier than what you're doing now. Okay, let's see. Another question that came in: wouldn't call or text reminders help with the cancellation and no-show rates? That is a really great question. So this practice actually already used a very robust reminder system. And what we determined was that a large number of the patients that were canceling were patients that likely went elsewhere due to the amount of time they had to wait to get an appointment. So they called up, scheduled an appointment. You said, okay, that's going to be 3 weeks from now. The patient thought, man, that's a long time away, but I'm going to go ahead and grab that appointment just in case I can't get anything better. They booked the appointment with you, hung up, and then started dialing other practices to try and find an appointment that they liked better. Then they got an appointment they liked better, and then they never called you back. So in that circumstance, a reminder system isn't going to help if the patient's already gone. And by that time, it's really hard to fill those empty slots if you kind of don't matter to the patient anymore. They've moved on. They've probably already received care and are under a treatment plan. And so being able to backfill those can be really difficult. Okay, so we're going to stay on for just a few more minutes. If anybody has any more questions, I do have a couple more to go over, but please use the Q&A tool to submit those, and I'd be happy to answer any questions that anyone might have. We're in no rush. Okay, let's see. So we have, do you have to double book to offset potential no-shows? We can give recommendations on when to overbook from our template analysis and from our optimization studies. But our preference is to use data really to predict the appropriate way to schedule. And so really the answer is no. We use historic demand to make the right choices for your practice based upon the mix of patients that are to be seen. And certainly if we want to spend any time one-on-one to answer any of these questions, I can be reached at sales@opargo.com. Nancy Harvey, again, is my name, and the email address is there on your screen. So we do have one last question. It looks like this is about the equal distribution of new patients that we were talking about. We have a new doctor in our practice. Can we make sure that she receives more new patients than our existing providers? So it sounds like this practice is wanting to incent a new provider by giving her more than her fair share. So absolutely, if you'll remember on that distribution screen, one of the providers had 5 new patients to every other doctor's 1. The configuration tool that the Opargo team created is very flexible to accommodate all different types of situations. So you can have different groups based upon the types of patients that people treat. You can have different distributions based upon wanting to incent a senior doctor or wanting to incent a junior doctor. It's definitely very flexible and allows for various setup situations. So let's hang on for 1 second longer and just see if we have any more questions trickle in. Again, I'd be happy to answer any questions one-on-one. If anyone would like to discuss their practice's needs, I can be reached at sales@opargo.com. It looks like those are all the questions that we're going to have. So thank you guys so much for joining today. We really appreciate your attendance. We will post this webinar on Opargo's website if you would like to revisit it. And then I can send a copy also to everyone who participated today. Thanks so much.